It's the Real News Network. I'm Sharmini Pires coming to you from Baltimore. The Affordable Health Care Act is a thorn in the eye of Republican lawmakers. But despite repeated promises to repeal and replace Obamacare, the health care bill is stuck in the Senate. The Senate cannot agree on what kind of health care system they would like to promote. Senate Minority Leader Chuck Schumer responded to the situation as such. Let's have a look.
Now it's getting clearer and clearer that Senate Republicans won't be able to pass either their bill or a backup plan of repeal without replacement. We Democrats believe that the time has finally come for our Republican colleagues to take us up on our offer of working together to improve the health care system rather than sabotage it. Evidently, President Trump is proposing a different path. He wants to throw up his hands rather than roll up his sleeves to work with us and solve the problem. But let's be very clear about what the president is proposing and where his path would lead. The president would not be, quote, letting Obamacare collapse. He is actively trying to undermine the health care system in this country, using millions of Americans as political pawns in a cynical game.
Dean Baker from the Center for Economic Policy and Research wrote in his recent blog that even without a vote in Senate, Obamacare is already in the process of collapse because Republican governors in red states are sabotaging it, or at least refusing to make the minimal effort to keep it alive. Dean Baker is the co-director of the Center for Economic Policy and Research in Washington, D.C. Good to have you with us, Dean.
Thanks for having me on.
So, Dean, in your blog, as I said, you wrote that Obamacare is collapsing specifically in red states because of the lack of competition in the exchanges. This means that people may still purchase insurance, but they have no real choice as to an insurer when there is only one insurer available in their area. So explain that to us and explain how it is being sabotaged.
Well, a lot of people probably heard Donald Trump and many of the Republicans in Congress making a big point of saying how we have over 1,300 counties in the country where there's only one insurer. And there's, in fact, a few counties where there's, at this point, no insurers in the exchange. And they've harped on this and said, well, this is, a collapse of Obamacare. And we looked at this more closely because the map's quite striking. When you look at it, overwhelmingly, the counties where there's only one insurer are Republican states. So we just did a simple calculation. We said, what's your probability of being in a county where there's only one insurer in the exchange? And in a Republican state with a Republican governor, straightforward definition, it's over 20%. So over 20% of the people who live in states with Republican governors have one insurer in their exchange. And again, in some cases, zero. If you're in a Democratic state, and we pulled out North Carolina because they'd had a Republican governor and they still have an overwhelmingly Republican legislature, so we just pulled that one out. They elected a Democrat in January. Otherwise, your probability of being in a county with only one insurer is just 1.8%. So the basic story, this idea of the competition in the exchange disappearing, this is overwhelmingly a Republican state problem. It's basically, you could always have more competition. It's generally good, but it's basically not a problem in the states where Democrats are governors. And when we look at it more closely, there's sort of simple explanation here. Basically, the Democratic governors have tried to make the act work, and part of that was expanding Medicaid. All the states with Democratic governors expanded Medicaid, and what that meant was you directly extended care to a lot of people, but also you pulled a lot of the less healthy people out of the exchanges, which made it a better market for the insurers. So they're always happy to insure healthy people. So you pull a lot of less healthy people out, it makes a better market. The other thing that they did was they tried to promote the exchanges. They tried to encourage people to buy insurance. And kind of a simple story there. People who are less healthy, you don't really have to prod them, in the sense that they know they're going to have big bills, so they're happy to buy the insurance. It's the more healthy people. So you get a more balanced exchange if you make an active effort to try and get people into the exchanges. So that seems to be the story in the states where Democratic governors were in control. Whereas in the Republican states, they didn't want the Affordable Care to work, and in a lot of cases, it's not working very well.
Now, one of the criticisms on the part of the Republicans who were promoting the repeal and their new act is that there isn't enough young people who are registering for insurance, young healthy people that is, that are registering for health insurance, and this causes an imbalance in the system that can cause a deficit. Explain what they actually mean by that, and is it a deficit?
Well, the logic, and they focus on young people and put the word in healthy. We want healthy people. Yeah, well, we want healthy. For the logic of the insurance to work, you need healthy people because, you do obviously have people who are less healthy and they're going to cost a lot of money. And if they aren't paying that in their premiums, that means, the insurance companies lose money. And, it's not a question of liking insurance companies or not liking. They aren't going to be in there to lose money. So you need healthy people in the exchanges. And the argument that the Republicans have made is, oh, this is unattractive, healthy people aren't going in the exchanges. The reality is we've actually had so much more people insured than had been projected. Now, they're not in the exchanges in the number projected, and the reason for that is more of them are now covered by employers. So the projections made back in 2012, before the Affordable Care Act took effect, assumed that you'd have about 3 or 4 million fewer people insured by their employers, and that those people would have ended up in the exchanges. As it turned out, employers haven't dropped coverage at the same rate as was expected. So insofar as people aren't showing up in the exchanges, healthy people, that's the biggest factor. And when I'm saying healthy people and linking that to employer-provided insurance, there's a simple story there. If you're working full-time, which is the basic story if you're getting employer-provided insurance, then you're reasonably healthy as a general rule. So by virtue of the fact that you have, say 4 million more people with employer-provided insurance than had been projected, you're keeping relatively healthy people off the exchanges. So that's the dynamic. I mean, you could say, well, that's a problem. That does mean fewer healthy people on the exchange. But it's not that all these people are saying, oh, that's a bad deal. What's happening is their employers are providing them insurance, so why should they go on the exchange?
All right. So when we're talking on the left and we're debating the Obamacare and pushing for that, or we're some states and some parts of the healthcare movement has certainly gotten behind the single-payer system. And you recently said in a New York Times piece, you suggested in light of the Republican policy, Democrats may decide to go for a single-payer system. Why did you say that, and is that a feasible option for the Democrats?
Well, I think people realize this is not where we want to end up. Maybe that was always the case, but I think it's become very clear. The Affordable Care Act, in my view, is a big step forward. You have over 20 million, almost 30 million people have gotten insurance who didn't previously have it, and that's a really, really big deal. But you still have a lot of high copays, a lot of deductibles. It's unnecessarily complicated. So I think people realize increasingly that we do want something like, I'm tempted to say universal Medicare, but even that, of course, isn't a pure single-payer system. But, in any case, something, let's say, like the Canadian system, where you have a universal system that everyone's in. So I think that's, a feasible program to move towards. We will not get there in a single step, though. I don't think it's plausible to think, best case scenario, we get someone good in the White House in 2021 and Democrats control Congress. We're still not going to get there in a single step. So I think we have to think, how can we do this piecemeal? How can we pull more people in, lower the age to Medicare, at the same time that we do things like have a public option in exchanges, better subsidies so that people have lower deductibles, lower copays. So I think we have to think about how we, sort of say, okay, single payer is where we want to get, but we have to do this piecemeal and have kind of a process for getting from here to there.
All right, Dean, I thank you so much for joining us today and explaining this part of the contestation in Washington, and look forward to having you back.
Great. Thanks a lot for having me on.
And thank you for joining us here on the Real News Network.